9 dangerous warning signs your blood sugar is high. Maintaining healthy blood sugar levels is essential for overall well-being, particularly for individuals with diabetes or those at risk of developing it. High blood sugar, or hyperglycemia, can lead to severe health complications if not managed properly. Understanding the warning signs of high blood sugar can help you take timely action and prevent further issues. In this video, we will discuss the 9 dangerous warning signs that indicate your blood sugar might be elevated. Recognizing these symptoms early on can empower you to make informed decisions about your health and seek appropriate medical advice. Let's explore these critical indicators to ensure you stay on top of your health. 1. Excessive thirst. Feeling very thirsty even after drinking a lot of water. Excessive thirst, a hallmark symptom of diabetes, is often a result of the body's attempt to manage high blood sugar levels. When blood glucose levels are elevated, hyperglycemia, the kidneys work harder to filter and absorb the excess glucose from the blood. This process leads to increased urination, causing the body to lose more water than usual. Here's a detailed explanation of excessive thirst in relation to diabetes. Elevated blood sugar levels trigger a cascade of events where the kidneys attempt to remove excess glucose by producing more urine. This leads to dehydration because the body loses more water than it takes in. People with diabetes may experience an unquenchable thirst, even after drinking large amounts of fluids. This persistent feeling of thirst is a direct result of the body's efforts to maintain fluid balance and compensate for fluid loss through urine. The primary cause of excessive thirst in diabetes is hyperglycemia. Insufficient insulin or insulin resistance prevents glucose from entering cells for energy, leading to high blood sugar levels. The body responds by extracting water from tissues to dilute the glucose in the bloodstream, resulting in dehydration and subsequent thirst. Continuous excessive thirst can disrupt daily activities and sleep patterns. It may lead to frequent urination, polyuria, another common symptom of diabetes, which exacerbates dehydration and worsens the sensation of thirst. Managing excessive thirst involves controlling blood sugar levels through medication, insulin therapy, and dietary adjustments. Monitoring blood glucose levels regularly and following a structured meal plan can help prevent fluctuations that contribute to excessive thirst. Adequate hydration with water or other non-sugary beverages is crucial, as is seeking medical advice promptly if thirst persists despite these measures. Addressing excessive thirst in diabetes requires a comprehensive approach to managing blood sugar levels effectively and maintaining overall health and well-being. 2. Frequent urination. Frequent urination, particularly an increased need to urinate both during the day and at night. Nocturia is a common symptom associated with diabetes. Particularly when blood sugar levels are elevated, hyperglycemia. Here's a detailed explanation of frequent urination in relation to diabetes. When blood sugar levels are high, the kidneys attempt to filter and absorb excess glucose from the blood. Glucose molecules, however, are too large to be reabsorbed completely and remain in the urine. To maintain balance, the kidneys increase urine production to eliminate this excess glucose, resulting in more frequent urination. Individuals with diabetes may notice a significant increase in the frequency of urination throughout the day and night. Nocturia, or waking up to urinate multiple times during the night, is especially common. This can disrupt sleep patterns and contribute to fatigue. Frequent urination in diabetes is primarily attributed to hyperglycemia, where insufficient insulin or insulin resistance prevents glucose from entering cells for energy. The excess glucose in the bloodstream prompts the kidneys to produce more urine to flush out the sugar. The need for frequent urination can interfere with daily activities and sleep quality. It may also contribute to dehydration if fluid intake does not keep pace with urine output. Managing frequent urination involves controlling blood sugar levels through medication, insulin therapy, and lifestyle changes. Monitoring blood glucose levels regularly and adhering to a balanced diet can help minimize fluctuations that contribute to increased urine production. Limiting fluid intake close to bedtime and practicing good sleep hygiene may also reduce nocturia. Addressing frequent urination in diabetes requires comprehensive management of blood sugar levels to alleviate symptoms and improve overall quality of life. Consulting with a healthcare provider is essential for personalized guidance and treatment options tailored to individual needs. 3. Fatigue. Fatigue that persists even after adequate rest can be a frustrating and debilitating symptom, especially for individuals with diabetes. When blood glucose levels are elevated, the body's cells may not receive enough glucose for energy due to insulin resistance or insufficient insulin production. This leads to feelings of tiredness and weakness, even after a full night's sleep. High blood sugar levels can lead to increased urination, causing dehydration. Dehydration can contribute to feelings of tiredness and fatigue, regardless of sleep quality. Coexisting conditions such as thyroid disorders, anemia, or depression, which are more common in individuals with diabetes, can also contribute to fatigue. Addressing fatigue in diabetes requires a holistic approach that includes managing blood sugar levels effectively, adopting healthy lifestyle habits, ensuring adequate hydration, optimizing sleep quality, and managing stress effectively. By addressing these factors, individuals with diabetes can reduce feelings of fatigue and improve their overall quality of life. 4. Blurred vision. Blurred vision, often associated with diabetes, can be a symptom of fluctuating blood sugar levels affecting the eye's ability to focus properly. Here's a detailed explanation of blurred vision in relation to diabetes. Blurred vision in diabetes can occur due to several reasons. Elevated blood glucose levels can lead to swelling of the lens in the eye, affecting its ability to focus and causing blurry vision. Changes in fluid levels within the eye due to fluctuations in blood sugar can also impact vision clarity. Over time, high blood sugar levels can damage the blood vessels in the retina, diabetic retinopathy, leading to vision problems including blurred vision. People with diabetes have a higher risk of developing glaucoma, which can cause blurred vision if left untreated. Diabetes increases the risk of developing cataracts, a clouding of the lens in the eye that can cause blurry vision. If blurred vision persists or worsens, it's important to seek prompt medical attention. An eye care specialist or healthcare provider can assess the underlying cause and recommend appropriate treatment to protect vision and overall eye health. By addressing the factors contributing to blurred vision and maintaining regular eye care, individuals with diabetes can minimize vision problems and preserve their vision quality over time. 5. Constant hunger. Constant hunger, also known as polyphagia, is a common symptom of diabetes and can be particularly distressing for those experiencing it. This condition occurs when the body is unable to properly use glucose for energy, leading to persistent feelings of hunger even after eating. Here's a detailed explanation of constant hunger in relation to diabetes. Causes. Constant hunger in diabetes can be attributed to several factors. When blood sugar levels are high, glucose remains in the bloodstream instead of being used by cells for energy. The cells, starved of energy, signal the body to consume more food. In type 2 diabetes, cells become resistant to insulin, making it difficult for glucose to enter cells. This lack of energy in cells triggers hunger signals. In type 1 diabetes, the body produces little or no insulin, leading to elevated blood sugar levels and persistent hunger. Symptoms. Constant hunger in diabetes is characterized by feeling hungry shortly after meals, craving food, especially carbohydrates and sugary foods, eating larger quantities of food than usual without feeling satisfied. Impact. Persistent hunger can lead to overeating, weight gain, and further complications in managing diabetes. It can also contribute to feelings of frustration and difficulty adhering to a healthy eating plan. If constant hunger persists despite efforts to manage blood sugar levels and adopt healthy eating habits, it's essential to consult a healthcare provider. They can assess for any underlying issues, adjust treatment plans, and provide guidance on managing hunger effectively. 6. Unexplained weight loss. Unexplained weight loss, particularly in individuals with diabetes, is a concerning symptom that indicates underlying issues with blood sugar management. This symptom involves losing weight unexpectedly without changes in diet, exercise, or other lifestyle factors. Here's a detailed explanation of unexplained weight loss in relation to diabetes. Causes. Unexplained weight loss in diabetes can be attributed to several factors. In type 1 diabetes, the body produces little or no insulin, which is necessary for cells to absorb glucose for energy. Without sufficient insulin, the body begins to break down fat and muscle for energy, leading to weight loss. In type 2 diabetes, cells become resistant to insulin, causing glucose to remain in the bloodstream. The body may respond by breaking down fat stores and muscle tissue to provide energy, resulting in weight loss. Elevated blood glucose levels can lead to frequent urination, polyuria, and loss of calories through urine, contributing to weight loss. Symptoms. Unexplained weight loss in diabetes is characterized by significant weight loss without intentional changes in diet or physical activity, loss of muscle mass and fat stores, increased appetite despite losing weight. Impact. Unexplained weight loss can have several adverse effects. Losing weight rapidly can lead to deficiencies in essential nutrients, impacting overall health. Loss of muscle mass can result in physical weakness and fatigue. Reduced body mass and nutrient deficiencies can weaken the immune system, making the body more susceptible to infections. If unexplained weight loss persists despite efforts to manage diabetes, it is essential to consult a healthcare provider. They can evaluate the underlying causes, adjust treatment plans, and provide nutritional guidance to address weight loss. 7. Frequent infections. Frequent infections, such as yeast infections and skin infections, can be a common issue for individuals with diabetes. These infections can occur more often due to the effects of elevated blood sugar levels on the body's immune system and other physiological processes. Here's a detailed explanation of why frequent infections are associated with diabetes. Causes. Several factors contribute to the increased risk of infections in people with diabetes. Elevated blood glucose levels provide an ideal environment for the growth of bacteria and fungi. Diabetes can affect the immune response, making it less effective at combating pathogens. This weakened immune function makes individuals more susceptible to infections. Diabetes can lead to poor blood circulation, particularly in the extremities. Reduced blood flow can impair the delivery of immune cells to sites of infection and slow the healing process. Nerve damage caused by prolonged high blood sugar levels can lead to a lack of sensation in the feet and hands. This can result in unnoticed injuries that become infected. 2. Types of infections. Common infections associated with diabetes include yeast infections. High blood sugar levels can promote the growth of Candida, a type of yeast that can cause infections in areas such as the mouth, thrush, genitals, and skin folds. Skin infections. Bacterial infections like cellulitis, boils, and infected cuts or wounds are more common in people with diabetes. These infections can be more severe and take longer to heal. Urinary tract infections, UTIs. Elevated blood sugar levels can increase the risk of UTIs, especially in women. Foot infections. Diabetic neuropathy and poor circulation can lead to foot ulcers and infections, which can be difficult to treat and may lead to severe complications. By understanding the link between diabetes and frequent infections, individuals can take proactive steps to manage their condition, reduce the risk of infections, and maintain overall health and well-being. Regular monitoring, good hygiene practices, and prompt medical intervention are key components in managing this aspect of diabetes. 8. Slow healing wounds. Slow healing wounds are a common and significant concern for individuals with diabetes. These wounds, including cuts, scrapes, and ulcers, tend to take much longer to heal compared to those in people without diabetes. Here's a detailed explanation of why slow healing wounds occur in diabetes and how they can be managed. 1. Causes. Several factors contribute to slow wound healing in diabetes. Elevated blood glucose levels can impair the function of immune cells and reduce the efficiency of the body's healing processes. High sugar levels also create an environment conducive to infection. Diabetes can cause damage to blood vessels, leading to poor circulation, particularly in the extremities. Reduced blood flow means less oxygen and fewer nutrients are delivered to the wound site, slowing the healing process. Nerve damage, diabetic neuropathy, can result in a loss of sensation, especially in the feet and hands. Individuals may not notice minor cuts or blisters, which can become infected and take longer to heal. Diabetes can weaken the immune system, making it less effective at fighting off infections and supporting the healing process. High blood sugar levels can enhance bacterial and fungal growth, increasing the risk of infections that can complicate wound healing. Symptoms. Symptoms of slow healing wounds in diabetes include wounds or sores that remain open and do not show signs of healing after a few weeks. Persistent redness, swelling, and warmth around the wound. Pus or other discharge from the wound. Increased pain or discomfort at the wound site. Signs of infection, such as fever or chills. Impact. Slow healing wounds can lead to several complications. Chronic wounds are more susceptible to infections, which can spread to surrounding tissues and bones. Diabetic foot ulcers are a common complication, especially on the soles of the feet. Severe infections or lack of blood flow can lead to tissue death, gangrene, sometimes necessitating amputation. Chronic wounds can cause significant discomfort, restrict mobility, and impact daily activities. By addressing the factors contributing to slow healing wounds and adopting proactive measures, individuals with diabetes can improve wound healing, reduce the risk of complications, and enhance their overall quality of life. Regular monitoring, proper wound care, and seeking medical attention promptly are essential components of effective wound management in diabetes. 9. Dry mouth and skin. Dry mouth and dry skin are common symptoms associated with diabetes, often resulting from high blood sugar levels and their impact on the body's hydration and skin health. Here's a detailed explanation of these symptoms and their relation to diabetes. 1. Dry mouth, xerostomia. Causes. Elevated glucose levels can cause dehydration, leading to a reduction in saliva production. This dehydration occurs because the body pulls fluids from tissues to dilute the excess glucose in the bloodstream. Some medications used to manage diabetes and other conditions can have dry mouth as a side effect. Diabetes can cause autonomic neuropathy, affecting the nerves that control salivary glands and reducing saliva production. Diabetes increases the risk of oral infections such as thrush, which can contribute to dry mouth. Symptoms. A persistent feeling of dryness or stickiness in the mouth. Difficulty swallowing, chewing, or speaking. Sore or dry throat, cracked lips and mouth sores. Bad breath. 2. Dry skin. Causes. High blood sugar levels cause frequent urination, leading to dehydration and dry skin. Diabetes can impair blood circulation, particularly in the extremities, leading to dry and less supple skin. Diabetic neuropathy can reduce sensation in the skin, making individuals less aware of minor injuries and leading to skin problems. Diabetes increases the risk of skin infections, which can dry out the skin and cause itching. Symptoms. Persistent dryness and flakiness of the skin, itching or irritation, cracks and fissures, especially on the feet and hands. Rough, scaly patches of skin. If dry mouth and dry skin persist despite these measures, it is important to consult a healthcare provider. They can help identify any underlying causes, adjust treatment plans, and recommend additional strategies to manage these symptoms effectively. Proper management of blood sugar levels, along with these preventative measures, can significantly reduce the impact of dry mouth and skin on daily life. It's crucial to be aware of these symptoms and take them seriously, as early detection and management can significantly improve your health outcomes. If you recognize any of these warning signs, consult with a healthcare professional to get proper guidance and treatment. Managing your blood sugar levels is a key step towards maintaining your overall health and preventing serious complications. Stay informed, stay healthy, and take control of your well-being. Thank you for watching our video on the 9 dangerous warning signs your blood sugar is high. Don't forget to like, share, and subscribe for more health tips and information.